And there it is. So welcome everyone to our Lakes Area COVID and Vaccination Update webinar. My name is Matt Killian. I'm the president of the Brainerd Lakes Chamber, and I have the honor to serve as your webinar facilitator today. A couple of people that I'd like to introduce that will be part of this as well from our staff team is Colleen Doles, who's our executive assistant. You can't see her on the screen, but she's the Brainerd Lakes Chamber logo, and she's going to be running Zoom and our AV today. So if you have any technical difficulties, just chat with Colleen. And then Paula Chapoulis, who leads our Blue Ox Business Academy business training program, will be keeping us all on time today because we have a number of speakers. So thank you, Paula, as well. Just by way of welcome and introduction, hey, you know, we may finally be at the beginning of the end here. I keep on saying that, but I think this time it might be true. You may have seen the news reports yesterday that good news, cases and hospitalizations are trending downward in Minnesota. And I'm sure everyone knows this, but most businesses, of course, are fully open. However, our hospitality sector that is so important to the Brainerd Lakes area is not fully open. There's still some onerous restrictions that are keeping them potentially of taking advantage of the full summer tourism season. That economic impact not only, you know, impacts the tourism businesses, but it impacts our entire economy. So that's of great concern to our chamber and chambers throughout our region. The good news is that, and I'm sure you've seen this in the news as well, that Governor Walz appears to be ready to make a major dial turn to loosen COVID restrictions in the state. We understand that this announcement will come with a firm reopening date. I cannot confirm that, but over the past 15 months or so, I've developed my own sources, and people that I trust say that the reopening date is coming with that. So stay tuned for that, hopefully this week. At the chamber, and alongside a lot of you, our shared goal is to reopen. But our other goal is to stay open as a business community. And there's no doubt that these restrictions impact businesses, but so do the quarantines and shutdowns due to illness. And so I think that's an important point as well. With the tight labor market, I do not know of a business that can afford to lose employees right now. Especially as we approach peak season. So our message at the chamber is to maintain those safety measures, but strongly consider the vaccine. We are not pushing the vaccine, but this webinar is about vaccination options. And we've seen lots of businesses now take steps and lead on this issue. And so we want to highlight that today. By the way, the governor's administration and our interactions say the target is 80% vaccination rate. Maybe our county and healthcare professionals can comment on that. We're a long way away from that. So that's something we should all be paying attention to. So that's what this webinar is about and what business can do and are doing with vaccines. So with that, I'm going to ask Colleen to change the slide, shift the slide. And I want to briefly recognize our partners. As usual, this is not a Brainerd Lakes Chamber effort. We have a cast of thousands here that helped pull this webinar together in relatively short order last week, believe it or not. And, you know, it's partnership that makes our community great. So you're going to see the counties, Bladek, who's 30 feet down the hall from me, excuse me, area chambers, our 3 medical systems, the Human Resources Association, Grandview Lodge, CTC, Kristi, who financially supported this webinar, and the list goes on. So thank you to our partners for helping sponsor and promote. And then I want to give you just a brief review of the agenda, and then we'll get going. So one more slide. And so this is what we're going to be doing today. First of all, we're going to set the stage with a COVID overview by both Lakes area counties, both Cass and Crow Wing counties. We're going to shift to our healthcare system updates and some information about the vaccine and vaccinations in general. Then HR considerations for businesses that are thinking about promoting the vaccine or scheduling an on-site clinic. And then finally, local business experiences at both CTC and Grandview Lodge. We're going to save all the questions for the end. So write down those questions, and we're going to save as much time as possible for your questions to any of the presenters at the end. So with that, let's get started. I'm pleased to introduce our two county representatives. Michelle Moritz is the public health supervisor for Crow Wing County, and Jeri Seegmiller is the Cass County team leader for Health, Human, and Veteran Services. They're going to help us set the stage. So I would turn it over to Michelle and to Jeri. Thank you.
Good morning. Thank you for putting on this webinar for our businesses and allowing both Jeri and I to be a part of this presentation. If you want to advance the slide, please. First piece that we'd like to look at is our current COVID data and trends that we are seeing.
Good morning, and yes, thank you. Welcome. Pleased to be here. So to go quickly from Cass County, this slide shows our current 14-day case rate and positivity rate. So we are at a statewide data for positivity as of 4/17, or the most recent that I have available is 5.9% positivity rate. And that's both in PCR and antigen testing that has been completed for Cass County. The two on the right-hand side are our daily rates that we run internally, and you can see the trending over the last 14 days. We are at 132 active cases as of 5/2, and with a case rate of 45.48 for our school case rate. We saw that November spike and then that early April spike there, and you can see the trend over time there. Go ahead and advance the slide. Thank you. This just talks about since the beginning of the year, our total percent of hospitalizations, ICUs, and death rates, and where that has trended over the course of the entire pandemic. Cass County has had 2,649 cases with 28 deaths. Our most recent was reported last week. We've had 187 hospitalized residents, and 46 of those have been in ICU stays. You can see the trend of ages there, and I won't go into that in any length, but you'll note that since vaccination started in January, some of those age ranges have kind of decreased a little bit, especially in that over 65 population. Go ahead.
Kind of this looks at the last several weeks, and like Jeri had said, we were starting to see cases rise in early April, late May, or not May, but March. And with that, just kind of a quick snapshot of it is look at across the state. The darker colors of blue is going to be the higher case rates per 10,000. So this is where you can compare apples to apples when we look at a 10,000 per population ratio. And that darker blue there was trending and has started to come back down there in week 15. Slide, please. For Crow Wing County, here's the numbers that we use with the school population, looking at the 14-day case rate. So it gives us a better snapshot of data over time versus a daily rate where we might see one day we have 5 positive cases and the next we have 30. Well, it really depends on when they're pulling those or taking those tests. Like on the weekends, we tend to see testing to be a little bit lower in volume or quite a bit lower. And then Monday, when people are back and active again, they are getting back out and getting tested and finding higher rates. So this looks over a period of time. So from early in the year to the present time, we had that steep increase there that we were concerned about. Our county for Crow Wing case total is 6,490. We've had 339 hospitalized and 87 deaths as of yesterday's data. Slide, please. COVID vaccine, though, the good news that we have seen the cases drop because of the active work from both healthcare, pharmacies, and local public health to provide these vaccines across the state. Slide, please.
And just very quickly, this is what our Cass County data looks like. We've administered 16,865 doses. Please remember that we have Leech Lake Reservation. It takes up a large portion of our county, and we have worked collaboratively with them to administer many thousands of doses of vaccine in mass clinics, seeing upwards of 1,200 people attend the clinics over the course of 2 or 3 weeks. 7,792 have completed the vaccines, and then you can see the age range there. We've also targeted our homebound different employers, employer groups, community groups, citizen groups, and are currently at a weekly vaccine clinic type schedule. Next slide, please. And looks like one of the slides slipped there, but this just looks at the 65 plus population. We are over 70% have completed their series. And then if next slide, please. Looks at the 16 plus, and here's where we have a lot of work to do. We have about 44% 16 plus that have completed or started and or completed the series, and it's also broke down by zip code there. You can see we've got some pockets that we really need to work on targeting.
For Crow Wing County, here are the rates. These rates are all available on Minnesota Department of Health's website. They have a COVID response page that you're more than welcome to come back and look at. The lower age ranges, the 16, 17-year-olds, we have a lot of work to go there, but that darker color is the goal that we want to get to for our COVID vaccine rates. Slide, please. And on these maps, what we're going for is that green. We want to cover the area that green. The darker the red, the less vaccinated individuals in that age range and that zip code. Slide, please. Opportunity. We would like to partner with our business community to offer on-site clinics. We are asking for clinics to have at least 10 individuals because most of our vaccine vials are based off of 5 or 10 doses per vial, and our goal is not to waste any vaccine. I know Matt is going to have this information in the email and registration, but also later on how to contact us to set up these clinics. Slide, please. And then just a quick, you may hear us say that we need to come back to have a second dose. There's 2 vaccines that are approved that currently require 2 doses. They do have different time frames, so it just depends on what Jeri and I have available to offer at the time. It could be 2 doses or 1 dose, and it could be licensed for individuals 16 and older or 18 and older. And knowing that this is changing and they are looking to get it approved, at least the Pfizer vaccine for down to 12 years old. So things are constantly changing in this, and we may have other vaccines also available in the future. Slide, please.
All right, well, thank you. And the quote that I've heard often is the best vaccine is the one you're offered. But thank you. That's a great stage setter as we look at the healthcare situation and then what employers are doing. So thanks, Jeri and Michelle. Colleen, I'll have you stop the PowerPoint for now as we bring in our healthcare leaders. We're very fortunate because we have all three chief medical officers for the three healthcare systems in the Brainerd Lakes area. So we have Dr. Christine Albrecht from Lakewood Health System, Dr. Peter Henry, Essentia Health, and Dr. Rob Westin from Cuyuna Regional Medical Center. They're going to provide an overview of their efforts, but also the COVID vaccine in general to further set the stage. And I believe, Dr. Albrecht, you had planned to kick us off.
Yes, thank you. It's great to be here. It's good to see so many people. I just want to go through a little bit of the vaccine basics and talk about the safety, the effectiveness, and just the importance of getting the vaccine out. As alluded to earlier, the Pfizer and Moderna both require 2 doses. They're based on mRNA technology, which is new and really made in the labs. Johnson & Johnson, or the Janssen vaccine, has viral cell technology, and that's 1 dose, and that's more like our flu vaccines, and some of our other vaccines have been made. The effectiveness comparison is interesting. These are all extremely effective vaccines, but they have not directly been compared one to another. So when Pfizer was doing its trials, there were some different strains around when the Moderna did theirs and when the Johnson & Johnson did theirs. But they're all extremely effective. And that's why when Matt said, take whichever one's offered to you, that's just really important. The only real difference that I would tell people is that Pfizer does go down to 16, and we're hoping by the next week or 2 that they'll be down to 12, and they're looking at even getting younger children vaccinated. These studies show that the effectiveness is over 90% at preventing disease, and we've been seeing that. We've definitely been seeing that in looking at all of these people 65 and up being vaccinated, how they've had a decrease in infection and hospitalizations. We've also been doing what we call point prevalence testing at all the nursing homes. And, a lot of those people have been vaccinated, and they get tested every single week, whether anybody's sick or not, just to really look for the disease. And we've been seeing that these vaccinated people just aren't getting sick, which is really nice to see. Looking at who's had their vaccine in Minnesota, we saw the countywide data, but 58% of the people over 16 have had 1 dose. There's just so much vaccine to be given. We have had 2 million people that are almost fully vaccinated, and over 2.5 million in our state have had at least 1 dose. We're doing great, but we need to keep going because we just need to get people vaccinated to move forward and get all these restrictions off of us. There are some side effects of the vaccines. We have to be real about that. You're going to get an immune response, for a lot of people. You're going to have muscle aches. You're going to be a little bit sore in the arm. You might have some fatigue, low-grade temperature elevation, depending, the younger people, when they get vaccinated, they have more side effects. They just have a more robust immune response. But usually this goes away in 1 to 2 days. And I'm just going to tell you personally, after my 2nd dose, I felt like I had ran a marathon, every single muscle in my body. The day after that, I felt amazing. I felt better than I felt in weeks, actually. So I don't know if there's any correlation with that, but I definitely thought it was very short-lived as far as the side effects. There are 2 serious side effects out there that we do always talk about. One is anaphylaxis, and your risk is so minute, but that's why we have you sit around for 15 minutes after the vaccine. And everybody who is giving the vaccine is able to take care of people if they would have an anaphylactic reaction. The other serious side effect that's on the CDC website, is the thrombosis with thrombocytopenia, and that was recognized after the J&J vaccine in women that were 18 to 49. Your risk of getting this is so minimal, but there are 2 other vaccine options out there if you would be concerned. The nice thing about the J&J, it's 1 and done. You don't have to come back. So that does provide some options for some people who it's hard to get back into the clinic or into back into work to get that 2nd vaccine. The safety of this vaccine is unbelievable. It is probably one of the safest vaccines, that's ever been developed. We know historically that within 6 weeks of receiving a vaccine, you're going to see a side effect if it's going to happen. This vaccine's been in millions of people for longer than that time. That's the reason the FDA required each of the vaccines to be studied for at least 2 months after the final dose before they allow the EUA and to let everybody have the vaccine. So we know that we haven't seen any of these long-term side effects. And in fact, they've also found that some people who have what we call COVID long hauler symptoms actually do better after they get a vaccine. So I just wanted to end my little piece by saying, why is it important to get your workforce vaccinated? It's the only proven strategy we have to get this pandemic under control. And immunity from natural illness is temporary. So you hear people, I don't need the vaccine, I had it. Well, we know that that's short-lived, 3 to 5 months for some people. And so far the vaccine is still protecting people months and months out. They're doing studies on this as it's going on. These people who initially got the vaccine and were part of the trials, they get their immunity levels checked, their antibody levels checked on a regular basis. We need to get to herd immunity before this thing mutates further and we have to start over with some vaccines. We really need to work on that, I think. And for a business, you're just going to have less lost time. People aren't going to be sick. They're not going to be quarantined. If you're vaccinated and you get exposed to COVID, you still don't have to quarantine. So that's the nice part about this. If you get vaccinated, your workforce can stay working. If you're not vaccinated and say you have a child that gets sick with COVID, then you have to be quarantined till the time that your child's sick, plus 14 days after. And then if another child gets sick, you can start this whole thing over and over again. And you can have employees out for months if they have enough kids that would get sick in sequence. So I just think it's really important that we understand how this can really just wipe out your workforce if they're not getting vaccinated and they're getting exposed. So with that, I will turn it over to Pete.
Thank you, Dr. Albrecht, and thank you for the opportunity to address the chamber. And I'm going to try to focus on a little bit about vaccine resistance. I really appreciate a lot of the statistics that Dr. Albrecht provided, but a couple of more I'd like to just throw at you. Since January of 2020, 1 in 10 people in the United States have been infected with COVID-19, and 1 in 575 have actually died from COVID-19. And it doesn't become real, I don't think, until you actually have a family member, a personal friend, or someone that's really close to you that has been impacted by this, either with a long-term illness with residual effects that Dr. Albrecht referred to as the long hauler, or those that have died. But no, healthcare is a very personal thing. And each one of us individually makes a number of healthcare decisions based on our personal beliefs, our prior experiences, our relationship with others, and our own sometimes political views as well. And I think that the message I'd like to convey to you is that there's a lot of misinformation and disinformation that's out there. And we were fortunate enough at Essentia Health to have a nationally recognized speaker come and talk about misinformation and disinformation, and how during pandemics you also have what she referred to as an infodemic, where you get so much information being thrown at individuals they kind of don't know what to listen to or where to seek good advice. The difference she described between misinformation and disinformation is misinformation, really people are trying to provide good information that is helpful and it's not meant to harm or dissuade somebody from taking and doing something, whereas disinformation is purposeful. It's really given to false information that's provided to individuals so that they will do and act in a certain way. And that's an important distinction to make as well. I think the other thing that I would ask you to do is actually have conversations if you're able to with your staff to better understand. Now, I recognize we can ask if somebody is immunized or unimmunized, but we can't ask why they don't get immunized. But you can offer questions to help me understand, or what questions do you have? And the most important thing is to make sure that you look for sources that are reputable. There was a book that was recently put out a couple of years ago by Tom Nichols. It was called The Death of Expertise. And in essence, he talks about that with the internet, that in essence, we seek medical and other advice from people who are not content experts. And I think that's really the key thing, is if you have someone who has questions, ask them to meet with their primary care physician or clinician. Those individuals do have access to very good, true information, and they can talk through the individual concerns. Oftentimes, for example, women of childbearing age have significant concerns about miscarriages, preterm births, fertility, et cetera. And they've actually studied this quite extensively. Out of 35,000 women who have been studied pre and post COVID vaccine era, there was really no difference in any of those rates. And that's a common misconception, that it can affect fertility and some of the issues around pregnancy as well. So the key message I want to leave you with is, number one, please open the conversation with your staff. It's really important. Number two, the incentives that Dr. Albrecht referred to is that getting us back to normalcy, our group settings, all the shopping, getting children back in school is really going to be key and dependent upon all of us, as many of us, getting vaccinated. We know that about 11% of people in Minnesota are either say, I don't think I'm going to get the vaccine. And then of those 11%, about half of them are saying, I will not get the vaccine. Studies show that for those 5%, most of the time we're kind of wasting our time conversation. So I want you to focus on those individuals that are delaying it, putting it off, or have, because of convenience, giving them time to find an opportunity to get the vaccine, and taking up public health and the healthcare systems and having people come to your workplace to get the vaccine. So I thank you for your time. I'll turn it over to Dr. Westin.
Thank you, Dr. Henry. So I thought I would just do a little bit of a summary of, from the healthcare standpoint and our health system specifically, how this has lived out too. And even related to what Dr. Henry was just saying and what Dr. Albrecht referenced too, when you get the vaccine, how that impacts on your employees and how that impacts on your ability to do the business. So obviously, as healthcare providers, we're all about sick people showing up and us taking care of them. But in the midst of this, when we were at the peak in November, that was extremely difficult to do when we did have family members, children out. We had to quarantine nurses and people that had to be taking care of folks in the hospital. And certainly when the numbers started to decline December into January, that seemed to be better as we got the vaccinated people going in our institution. And we're up to now, the numbers that I got are 80% of our providers have been vaccinated fully, and we're at about 55 to 60% of our employees, which is more of a microcosm of the society. Just like Dr. Henry said, that there are those even within healthcare employees that are skeptical or that don't want to get the vaccine for other reasons. But when we do have that amount of our employees vaccinated and providers vaccinated, we've been much better prepared to take care of folks when they do show up. And so I think in the last several months, we felt confident that we could handle this after the November surge came through. Then in the last, I think like the county was saying at the beginning, in the last end of March into April, the numbers started to climb. We were somewhat alarmed by that. Was this related to the fact that it was a different age group? Was it related to vaccine failure? Was it related to variants? Things like that. But bottom line is, it seemed like we're not seeing the failure of the vaccine. We're not seeing people breaking through having had the vaccine, but it's just hitting different populations of people within the state and the county that haven't been vaccinated yet. So you see children getting it, passing it on to their middle-aged parents, and then parents passing it on to potentially elderly family members. As you know, this vaccine or this virus tends to hit the elderly and the sick much harder. And even though we are at 80% or some of that, somewhere in that range of the 65 and older age range having vaccination, there's still 15 to 20% of people out there of that age range. Well, if you have more virus floating around, they're going to get exposed. And so they're the ones we're seeing being very sick in the hospital. And I don't know if it's relevant to the hospitality industries on the line and things like that, but you know, in our business, we have X number of beds, we have X number of people that end up in the hospital. Typically of that percentage, some of them are very sick and some of them aren't as sick. And obviously you plan your days and your staffing around that. Well, the problem with COVID is when people get sick with this, they're very sick and they're sick for a long time. And so they take a lot of resources, similar to what maybe a person coming into a hospitality industry that's more that demanding patient or family that wants more out of your staff. If you have more of those folks in your system, they're going to really take down what you can provide. And I think that's what we want to avoid, is getting those very sick people in the hospital, avoiding them having to come in. Obviously, those are the ones that end up with the higher mortality rates too. So just kind of a correlation there, that what we see is when you get people vaccinated, fewer people are getting sick, fewer resources are being used in our hospitals and our health systems, and that's really helping us out. Just kind of a quick touch base on the variants that are out there. I mean, Christine talked very well about the vaccine and its development. We certainly are seeing some concern about the variations in the virus that naturally occur when these viruses have enough people to burn through. They're going to continue to morph and change. And as they do that, they might change their ability to infect or ability to transmit disease. We haven't seen that result in them being ineffective in the vaccines working, but that possibly would be an issue that would prolong this epidemic or pandemic into an endemic potentially, where it's something that we live with, but maybe isn't quite to the numbers that we're seeing now. So we're hoping that these variants that we're seeing across Minnesota, the BK British vaccine is the one that seems to be the one most common now. Over 50% of people seem to be showing that one. And there is a Brazil variant out there that isn't quite as prevalent in Minnesota, but we do see some of that. And we're just tracking that very close. Minnesota Department of Health gets us reports on that. There may be ways that we can then in the future develop different vaccine upgrades that would be a booster that we'd receive and then be protected from those. So there again, people I've talked to in my circles are saying, well, I'm going to wait and just make sure that these variants don't need to have a different vaccine. That's really not the proper strategy, because if we can get vaccinated now, provide protection, and then if we do need a booster in a year, that would be the way to go. And that would obviously be a way we can kind of calm down this entire virus as it goes through the state. So those are just some final thoughts that I had. And we hope that that's helpful as you as employers are looking at this, and certainly want to encourage you to look at the benefits and try and encourage your staff, and then work with us, whether it's healthcare providers, our systems, or the county, in getting these clinics set up either in your walls or through the county. We're planning on continuing to offer vaccine clinics because the numbers are down. We're probably at CRMC going to be doing it more as a call in and get scheduled, 25 patients at a time, like Michelle said at the beginning, 5 to 10 people increments, because that's what the vaccine comes in. But those are the ways we're going to hope that this continues to roll out. So thanks for your time.
All right, well, thank you. Doctors Albrecht, Henry, and Westin, really appreciate setting the stage there and giving us some more information on vaccinations in the area and what to think about when it comes to making that voluntary personal choice, whether or not to get it. So I'm going to shift gears now to the HR issues. And we're very fortunate to have for those businesses that are considering either promoting or scheduling an on-site clinic. You might be wondering, what are the HR issues that I should be paying attention to? And we're very fortunate again to have an attorney that specializes in such things. Tom Revnew is an attorney and shareholder with PRK&A Law, and they exclusively focus on representing employers and labor and employment matters. And I'm not going to divulge anything, but my understanding, Tom, is you have a number of clients here in the Brainerd Lakes area. So we've worked with a number of our chamber members before. I'll turn it over to you. Colleen, could you get his PowerPoint rolling? So Tom, welcome.
Thanks, Matt, and thanks for having me this morning. And I will start off and let everybody know that I did get my Moderna shot. I had my second one 2 weeks ago, and everything went fine. But of course, as a labor and employment lawyer representing employers exclusively, I've had obviously quite a few questions being raised, particularly over the last year. And those of you who are business owners in HR, you're well aware that the laws have been changing dramatically. We've had new laws coming into existence. And of course, with the presidential election, we have a new administration coming in. And of course, so there's a little concern with regard to, are the laws going to be interpreted the same way as they were previously? And so I'm just going to highlight some of the items for you to consider as we go along. And so if we can go to the next slide, I'm going to cover very quickly some common questions that are asked. Can we inquire into an employee's vaccination status? Can we require an employee to get the COVID vaccine? What are the risks with regard to having a policy of mandating that employees get the vaccine? And then finally, what other options do employers have for encouraging employees to get the COVID-19? And if we go to the next couple slides here, I'll get into, can employers inquire into somebody's vaccination status? And the answer is, we go to the next slide, the answer is yes. Generally speaking, the EEOC has indicated that it's generally permissible for employers to ask employees about their vaccination status. And so that simple question, have you had the vaccine, is not likely to elicit information about possible medical conditions. However, as you heard a doctor state momentarily ago, you can't ask the question, why haven't you gotten the vaccine, unless it's job related and consistent with business necessity. And so I generally advise clients don't go beyond the question of have you been vaccinated, unless there's a legitimate business reason for you needing to have the knowledge of why they haven't gotten it. And of course, if you do ask for proof of the vaccination, you should ask for the date of the vaccination. And it goes without saying that the document itself, the vaccination document, should be treated as a confidential medical record that is maintained in the employee's medical file. But the simple question asking about vaccination status is okay. To ask the question, if they say I haven't gotten the vaccine, and ask them why not, that's where you run into trouble, because it may lead to the disclosure of somebody having a disability and being unable to get the vaccine for some reason. If we go to the next slide. So some privacy considerations to consider as an employer. Decide as a company if you need to know a worker's vaccination status, and if so, who's going to be responsible for that inquiry. And generally speaking, I've been advising clients that if you're going to ask about somebody's vaccination status, I would generally limit it to the HR person, the human resources person, and if you don't have an HR department, limit it to a business owner, but not something that you want everybody to necessarily know. Second, train managers not to casually ask about somebody's vaccination status unless in fact it is work related. Keep the information that you receive as to somebody's status confidential as you would any other medical information. And of course, ask employees to be respectful of other employees' privacy as it comes to medical issues. So there are some privacy considerations. My experience, both on a personal as well as a professional level, I think it's very common in workplaces for employees to talk about whether they've been vaccinated or not. I'm certainly not encouraging managers or supervisors to be asking those questions, because you run into issues with the Americans with Disabilities Act, as well as the Minnesota Human Rights Act, as to the confidentiality of somebody's medical status. Let's go on to the next slide. Perhaps one of the biggest questions that employers have been asking is, can we mandate that employees get a COVID vaccine? And the EEOC has issued guidance, which essentially it currently provides that, yes, you could mandate that employees get a vaccine. However, you have to be very careful in doing so, because employees may have a legitimate business reason or legitimate reason for why they don't get the vaccine. And that may be that they can't get the vaccine because they have a mental or physical impairment that rises to a level of a disability that may prevent them from safely getting the COVID vaccine. And so if they raise that they can't get the vaccine for medical reasons, then as an employer, you should engage in what's referred to as the interactive process with the employee to determine whether or not there are reasonable accommodations that you can make to overcome any limitations in their work duties that they be prevented from performing as a result of a lack of a vaccine. And then the second issue that pops up is that an employee may have a religious view that prohibits them from getting a COVID vaccine. And of course, the one that's most obvious to me is there's been a lot of literature and a number of churches that have raised issues with regard to the Johnson & Johnson vaccine and how that vaccine was developed. And so as an attorney, I am hearing issues with regard to employees having religious concerns about taking the Johnson & Johnson vaccine because of how that vaccine was developed. And you may be able to accommodate that religious concern by offering an alternative vaccine, whether it's the Moderna or the Pfizer. Next slide, please. So the bottom line is what the EEOC guidance provides, that you may have to accommodate an individual who's unable to take the vaccine because of their disability or because of their religious view. What I would suggest is that if you do mandate vaccines, and frankly, I don't have any clients yet who have mandated the COVID vaccination. I think many employers have been reluctant to do the mandate, but rather they're going a different path, which is offering incentives for employees to get the vaccine. And frankly, I think that's probably a better way to approach things from an employee morale standpoint. But if you do mandate and somebody's refusing to take the vaccine, I would highly recommend that you consult with an employment attorney before you determine to terminate them. Next slide, please. Couple other quick things is there have been other guidance with regard to under the CDC as to whether an employer may require or mandate a COVID vaccination, and as well as OSHA. OSHA says that an employer can make a COVID-19 vaccine or vaccination series available at no cost to eligible employees. Quick employment tip is if you do mandate the vaccine, an employee has an adverse reaction to the vaccine, that's recordable as a day missed from work. And let's move on to the next couple slides here. We're going to move forward from this slide. Just note that Minnesota state law raises an issue whether you can mandate vaccines or not. Let's move on. So the last topic I wanted to touch on, just in the interest of the shortness of time that we have, is I know some employers are asking the question, can we offer incentives? And the answer is yes, you can offer some forms of incentive to allow to encourage employees to perform or to get the vaccination. And I think that is what most employers are doing. They're offering the incentive of some additional paid time off. They're offering gift cards or other bonus payments, but they're incentivizing employees to get the vaccine. And just keep your eye out. We're still waiting for the EEOC to come out with guidance on incentive programs and what employers can do with the incentive programs and encouraging employees to get the vaccine. That should be coming out any day. It had not come out as of yesterday. And the final point that I'll make, I know that there are some employers that continued on with the Family First Coronavirus Response Act, even though it ended December 31st, employers could continue it on through the end of December. And if you did do that, and I know there are some employers in the Brainerd Lakes that did that, employees can get reimbursement for lost time as a result of getting the vaccine, as well as if they've lost time as a result of any adverse effects due to the vaccine. And I know a lot of employers are using that as another incentive to get the employees vaccinated. I know it's a very short period of time. Thank you for your time today.
All right, Tom, thank you. That excellent information on kind of what's allowable and what options that businesses might have. And we wanted to transition now into a couple of local business experiences. And we kind of curated these, but there are others as well. Probably some of you on the line that could share your own experiences. But I think since you mentioned financial incentives, maybe we'll pivot over to Kristi Westbrock from CTC. And just invite you, Kristi, to share what CTC did. What was the reaction? Why you did it, maybe, and what was the reaction to it? So I'll turn over to you.
Sure. Thanks, Matt. And thank you for having me today. CTC, early on, we started working with our employees prior to the vaccine release, asking them if they would want to get the vaccine once it's available. And what we did was we kept track of anyone who responded yes to that. And then we worked with Crow Wing County and also with CRMC to say, hey, at the point there's any excess vaccine that you have or you need to get rid of it quickly, call us, because we have a call list of employees who could be there within a matter of a half hour to be over there to get vaccinated. And that worked really well for us. We were so fortunate that CRMC was able to help us out to get some early vaccinations done, and also Crow Wing County. So I applaud the efforts of that, but it really was helpful in getting those early people the people that were confident vaccinated early. At that point, we saw we were about 30% of our employees that were interested in it. And as the vaccine started to roll out, a few more trickled in. But we kind of hit a plateau, and we knew that we had. And because we are a business that is so customer facing, entering people's homes, entering people's businesses, including healthcare, nursing home facilities, senior living, we felt it was important to keep pushing forward with encouraging our employees to become vaccinated. And so we did offer a $100 bonus to our employees if they would be vaccinated by Memorial Day. And so all they have to do is turn their vaccine card into HR, not their manager or anything like that. It's a confidential way for them to get it over to HR, and then we treat it as a confidential medical record also. And so today we're sitting just a little over 50% of our employees that are vaccinated. So the push has helped. We'd love to see that number here at CTC up into the 70 to 80%. But again, I feel like we've hit kind of the top point of the people who want to be vaccinated. I can tell you from a CTC perspective, the reason that we've taken an active push with our employees is because as a community that being owned by our community, we're a co-op, we're owned by the businesses that have us, we're owned by the customers that have us as a co-op, that we need to get our economy open. And from our perspective of really trying to move this along was really based on making sure that economically that we can keep seeing our businesses, our residential customers flourish within their jobs and within their businesses. And so we took a very upfront approach about the economic piece of getting vaccinated. And so with that, I can tell you that this is me on February the 26th, and the smile I think is coming out both sides of my mask getting vaccinated. And I have been very open and honest with the employees of my vaccination and the experience with it. So with that, Matt, I'll turn it back to you.
All right, thanks a lot. And I think you're the only business I know that I've heard that offers that financial incentives to go get it. So that was an example, at least we wanted to make others aware of. Jeri and Michelle at the beginning talked about these on-site clinics, and we had another notable business in the Brainerd Lakes area that you all have heard of, Grandview Lodge, that has gone that route. So I wanted to invite Merrick Dresnin, their HR director, to talk about that effort and how it's going. So Merrick, I'll turn it over to you.
Thank you, Matt. Yeah, it went very well. We had our initial clinic on April 22nd, and the reason that we did it from our employees and from a recruiting perspective, Dr. Henry had mentioned open conversation and open communication. From the very, very beginning of this pandemic mess, we have been openly speaking through email communication, et cetera, been very transparent with our employee population as to any positive cases we've had in the workplace, and we've had our share. with that, we also took some of those communication opportunities to talk about the upcoming vaccine clinic, which, as mentioned, we did in April. Had a few more participants than we anticipated. We opened it up to employees and their families. And then it was, I believe it was Moderna. And so the second vaccination is coming up in May. And we again will invite those who had the first one. We also are going to open it up to anyone else interested in having their first shot. And then we are going to also open it up to the public for anyone who would like that opportunity. And I also have to say, I mean, it's been a great partnership with Crow Wing County, the health department from the very beginning. Michelle, Moritz, and I have spoken quite a bit just to maneuver through these difficult times. But the vaccine clinic, you know, we have our share of people on both sides of the fence, so to speak, but it was taken very well, nothing negative. And I think it's because we didn't really talk one way or the other as to our position on the vaccine. We just offered it as another benefit to retain those we had and to heavily recruit for the many positions we still have open.
All right, well, thank you. Two different approaches there. And again, we're just shining the spotlight on a few options with notable businesses. I know we have manufacturers on the line as well, and I neglected to mention the Lakes Area Manufacturing Alliance is a partner in this effort as well. I'm going to turn it over to you. If you have a question, a comment, a story or experience to share, now would be your opportunity. Normally we use the chat, but I think with the number of participants that we have, if you want to chat and put your question there and comment, that's great. If you wanted to share something, just unmute and we'd be happy to take questions that way. But any questions, comments for the counties, the healthcare systems, Tom Revnew, our HR attorney, or any of the two businesses, we'll open up the floor.
Simply for, sorry, this is Colleen, sorry to interrupt, but simply for full disclosure, a public recording of this will be made available later, just so everyone knows before you share.
Matt, this is Tyler Glenn, Executive Director of the Bladick. My question is for Michelle Moritz with the county. Michelle, is there a policy or something in place as to when and if the county would go on site for a particular manufacturer or any business that would like to provide the option for their employees to be vaccinated?
Right. So we had asked originally for a larger number, but we have reduced that back to 10 individuals that are interested in being vaccinated at least. And what we do is we try to combine a few of these sites in a day so we don't have vaccine wasted, as well as quickly contacting others that may be due for their second dose. We're always trying to have as few doses wasted as possible, if none at all. But with that, I would like to collect names of the different businesses that are interested in having us come out, and we will work with our partners. There's many of us working to get vaccines out to our community. Our healthcare providers and pharmacies are also extremely active in this efforts and want to recognize all the work that they have done in getting us to the point that we are today. So I'm happy to collect those at the county, and then we'll find a partner to come out to vaccinate if it's not my staff that are coming out to you.
Thank you, Michelle. This is Pete Henry from Essentia Health, and I appreciate the call out to the other health systems as well and the pharmacy partners, because we all are willing to come and help at the job site.
Yeah, thank you. I'm reading a question here from Andrea in the chat. I'll just maybe recite it, and this might be one for Kristi or Tom. It could be for a variety of people, actually. What concerns are there with incentives provided to those who wish to be vaccinated versus those who do not, And how do you kind of reconcile the fairness of maybe paying someone a bonus versus someone decides not to get it for whatever reason? So I don't know if Kristi, you ran into that issue, or maybe Tom has an opinion on it. Either one.
Yeah, I can touch base with regard to some of the legal issues that I see potentials, right? And that is, let's say you offer the incentive that somebody's going to get $100 or they're going to get a paid time off as a result of getting the vaccine. And some of the issues, and this is why I think once we see the EEOC guidance that hopefully is going to come out, this week, next week, I think it'll be very helpful. But a couple things that I see are disability discrimination, religious discrimination issues. Okay, I can't get the vaccine because of my disability, but yet everybody's getting some type of incentive to get the vaccine. So I've been excluded from getting that incentive. And also keep in mind that these are new issues, right? I mean, these are unique issues in the world that we live in. And so there's not a lot of case law or statutory law that's going to address this, but I see the potential for a religious discrimination issue. I can't get the vaccine. You only offered Johnson & Johnson. Everybody got the $100, but I'm not getting the $100 because, I can't take Johnson & Johnson because of my religious beliefs. I think there are potential issues if you are unionized, that you have a duty to bargain with your union if you're going to offer an incentive for the bonus. There are some potential wage and hour considerations with regard to how you're incentivizing them to get the vaccine and how any bonus may be factored into an overtime calculation. So those are some of the issues that I see, some unaddressed legal issues that hopefully we'll get more guidance from the EEOC in the near future.
Can I just jump in? Andrea, thanks for the question. One of the things that we did have come up is we have a couple of employees who are pregnant right now and just had some concerns during their pregnancy of being vaccinated with some other things going on. And they talked to the HR person, and certainly we extended that once they have the baby and they can get vaccinated, that we'll honor, make that accommodation and honor that $100. And really, I think you can look at individual people, and at the time they make the decision to get vaccinated, and if they request that bonus payment, I certainly wouldn't ever say, no, you missed the timeline. I mean, the goal here is to get people vaccinated.
Yeah, both great insights. I'm going to look at my chat here from Beth. Tom, you had mentioned that it's okay to mandate the vaccine, even though there are a lot of businesses aren't doing that currently. But if there's a legitimate reason they can't get it, and if you can't provide a reasonable accommodation, can you let them go? I think, can you terminate that employee is what Beth's referring to. And what would be a reasonable accommodation example?
Yeah, so those of you who are HR professionals, you know that when you're looking at the ability to accommodate somebody, it becomes a very fact-specific analysis. And so it's very hard for me to talk about this specifically without knowing who the employer is and what the specific concerns are. One issue that comes up as an example, I believe, and I could be wrong about this, but I do believe, as an example, in the construction industry, I think we're going to start seeing owners of projects telling companies working on these projects that we're not going to allow employees to come onto our site unless they've been vaccinated. And so if an employee has not been vaccinated, they're not going to have work to work on that project. But a reasonable accommodation could be, I'm going to go ahead and assign you to another project, or I'm going to put you on a leave of absence until we have work available. But that's why I say that, if you are looking at terminating somebody because they're refusing to get a vaccine, I think you need to be very careful with that. And the EEOC makes it clear that you need to be careful about that, engage in the interactive process. And what I'm recommending to clients is consult with legal counsel to make sure that you do know what the potential options are. Bottom line is, so talk to the employee who's refusing to determine whether there is something within the reason that you can offer. Is there an alternative job that exists or not before you terminate?
Oh, that's great. I'm going to ask a question and maybe just prompt if there's any other businesses that have had some experience with, let's just say, encouragement. It'd be interesting to know what those experiences are. And we just picked a couple, but if you're on the line and you could share that, we would really appreciate that, because there's a lot of different sectors represented in our community. But one of the things that I would ask about, because we talked briefly about this before with the counties, is 90% of our 1,100 or so chamber members have fewer than 20 employees, and 75% have fewer than 10. So when we set that threshold, Michelle and Jeri, at 10 people based on the number of doses in a vial, we don't want to waste those. If a small business can't kind of let everyone get time off to go at once, can they partner with other small businesses in the neighborhood to do that? Is that something you'd be open to?
Absolutely. We did ask, though, that perhaps they come to one location to be served just for staff efficiency. But the other part is we do have a number of other community clinics that we have set up, as well as our healthcare providers and the pharmacies as well, offering vaccinations on a daily basis. So if it is less numbers, there are other alternatives as well as partnering with other businesses to host one site.
Yep, and we've done the same here too. We've either partnered with another business and or invited those businesses to attend a public clinic that we've been hosting. So we find a variety of ways to make it work for everyone.
That's good to know. I just wanted to prompt that because we had that question by email a few days ago. This might be a good question for our healthcare professionals. How often do you need to get the vaccine? Do you have to revaccinate every 6 months, or if you get it once or twice, is that good enough? And I just open it up to either doctors Albrecht, Henry, or Westin to answer that one.
I can start and then ask Dr. Albrecht and Dr. Westin, but I don't think the answer is out on that. I think most of the literature that I have read says that we will most likely require a booster similar to what we get on a yearly basis for influenza. But I don't think that anybody knows that at this point in time. We haven't fully defined how long is the immunity that you get after being vaccinated, or even in the case of how long is the immunity that you get after you've contracted a case of COVID-19 as well.
Right, and I would completely agree with Dr. Henry on that. I also think that we might need a booster just to cover more variants in the future. You know, maybe our immunity from this one lasts a long time, but with the new variants that keep coming up, we're probably going to have to get a booster just because of that reason alone.
All right, so I'll do one last call for questions, or if a business has an experience they'd like to share, we'd love to hear it. One more time for questions or comments. And if you have one, you can just unmute.
This is Dr. Henry. If I just may very quickly have a comment. You know, we've talked a lot about the vaccine, but there are many good therapies, specifically the monoclonal antibody therapy. And I would just encourage you to communicate with all of your employees that if they are symptomatic, to please get tested and get tested early. A lot of people are kind of forgoing testing, thinking that it's probably not as important, or if they're young, that it's not necessary. But we know that the monoclonal antibody therapy is extremely effective in keeping people out of the hospital. The initial trials showed that it was 80% effective. Anecdotally, most of the health systems that have been monitoring this have shown that it's even more effective than that. And the earlier it's given, it's a 10-day window, but the earlier it's given, the more effective it is. Thank you.
Somebody had earlier addressed the difference between endemic and pandemic. And I would like it if somebody could do a little bit of a discussion in that in relation to that concept of boosters and re-immunization, if you could.
I can take that one because I think I'm the one that brought that up, whether it was a mistake or not. Because there again, I don't think that, like Dr. Henry said, we know 100% where this is going, because obviously we haven't known for the last year and a half where it's going. But pandemic, unknown virus, you know, sweeping across the world, that's what a pandemic is. Endemic means that either we get vaccinated enough to calm it down so that it's just basically jumping from a few people over time, kind of like the cold viruses we see, other coronaviruses that we see. They're always out there. They're always giving us some infections, but most people have some immunity, or at least the virus isn't hitting everybody at the same time. So there is some thought out there that it's going to be really hard to knock this virus out completely, whether you talk vaccinations to the 80% range or whether you talk natural immunity. We hope that the virus does this on its own, that it just basically mutates to something that's not as virulent, and that would be a dream. But if it doesn't do that, then we might end up in this endemic phase where it's always out there at some level, but we have vaccines to combat it. Even the variants get vaccines made towards them. And then basically we just deal with it every year. So we could be looking at that, but we just don't know. So, I mean, bottom line is we continue to learn and continue to adapt what we do. And, you know, it's just frustrating for everybody, obviously wanting this to end, but it's not going to do that in the near future anyway. So.
Thank you. One more question popped up, and that's regarding insurance requirements. Do employees need to have health insurance in order to get vaccinated?
For public health, we are not billing insurances, and I do have coverage to be able to pay for the staff at this time to continue this work. And so we have not been collecting insurance information. The vaccine is provided to us by the feds, and so we aren't charging for that service.
Correct, same here.
All right. Any other questions, comments for our esteemed group of presenters today?
One last, Matt, if the health system folks in the county could respond, what if the FDA approves Pfizer's vaccine to be allow children under the age of 16 to receive the vaccine, will all three of our systems open it up, and the county potentially as well? And you know, what is that? I know this would be a concern for Merrick with employees under the age of 16, but what does the consent form look like for our parents? I don't know if you've seen anything like that yet. I mean, it's a fairly broad question, but now that this is on the table, I'm sure that there are a lot of folks on this that would be potentially asking that question.
Well, and even currently right now with 16 to 17-year-olds, it's requiring parental consent. So what has been happening at different sites, including the healthcare facilities, requiring parent signatures or parents to be present to provide that consent, as well as we're continuing to work with our school districts to look at, would we be potentially offering that even potentially prior to school being out this year, and how we would do that either during the school day, after school, weekends. But the great news is parents and these students are going to have multiple opportunities. And this is something that we're working on right now to have in place and be able to offer to the 12-year-olds on up as soon as it does become licensed. And we are expecting that soon.
I would agree. And I think that the nice thing is,
too, right? Go ahead, Christine. Sorry.
I think, you know, the nice thing is we've been expecting that it's going to be happening. So we're all preparing. So we're all kind of ramping up and know, yep, we know we need Pfizer. We need to be reaching out to these people. We're gearing up our media for it so that we can reach those people, and reaching out to the schools. We have the letters ready to go. We're just waiting for us to get the okay.
Great.
That's basically what I was going to say. We've done this with much creativity and all hands on deck for each of the populations that they've opened up to. So when it comes down to a lower age range, we're ready to go as well, and excited about it. So.
And the only thing I would add is we're all on what's called the EPIC electronic medical record, and there's an ability to proxy for those individuals that are too young to give permission themselves, so they can get proxy, I believe, through the EPIC format as well too.
All right. Well, thanks everyone for all the questions. Thanks for being here and spending an hour or so with us. Our group of presenters, very impressive group of people, very impressive set of information that you shared. So we appreciate that. I asked Colleen to put up our partners once again. Thank you to all of those organizations for getting behind this. A couple of things. Number one is after this presentation, the webinar, we're going to share a recording with our members. That'll go out this week. We're also going to continue sharing those mobile vaccination clinics information for both Cass and Crow Wing counties for those businesses that want to explore that for their employee teams. And then, the final word from us is that we want to get open. We want to reopen, but we want to stay open. And I can't tell you how important it is for our area and many other chambers throughout the state to get these businesses as safely reopened as possible by Memorial Day weekend. We're not going to have that same extension of summer tourism as we enjoyed last year with remote work and distance learning as a factor. Continue promoting safety. Please consider promoting the vaccinations among your staff, and stay safe. And let's get our economy reopened again. So thanks to everybody for spending some time with us this morning, and have a great rest of your day, great week. See you soon.